Good afternoon, everyone. Thanks for joining us today. My name is Michael Morgenstern, and I'm the Head of Marketing for the Expert Institute. Today's webinar is presented by Dr. Thomas Zaidan, a highly esteemed board-certified plastic surgeon based in Florida. He'll be discussing the role of a plastic surgery expert witness within the scope of litigation and everything attorneys need to know about scars. Dr. Zaidan is a member of the American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgeons. He performs a wide range of plastic surgery procedures, including breast augmentation, liposuction, and more. Thanks again for attending. Please welcome Dr. Thomas Zaidan.
Good afternoon, everyone. Scarring represents a considerable amount of litigation. Often experts like myself are called upon to diagnose scarring, talk about the extent of scarring, the neurological issues, the emotional impact, the functional limitations. Experts are often called upon to establish the future costs of scarring, and most importantly, how permanent a scar is. So, to understand scarring, we're going to talk about the basic science. I'm going to explain what a scar is, how a scar is a natural response to injury. I'm going to talk about what can be done, whether it be manipulative or perhaps surgical. I'm going to illustrate the types of scars and explain to the bar both the plaintiff's and the defense issues when evaluating a scarring claim. And finally, I'll discuss the impairment rating and functional issues of scars. Next. So how do you qualify an expert in scarring? Certainly you want a plastic surgeon who is board certified, but I implore you to pick a surgeon who is recognized by the licensing authorities. Paragraph, there are many courses that give the the physician, the ability to say they're board certified, but they are not recognized by the licensing authorities. In fact, a family doctor can take a brief course in laser, for example, and obtain a certificate stating I'm a board certified laser surgeon. So be sure that the licensing authorities in your state recognize the board. Be sure your expert is actually in practice, that he takes ER call, that he's on the trauma team, and he has a very high percentage of his practice actually taking care of patients. To be fair, an expert should be actively involved in the care of trauma patients. Your expert should be fair-minded. He should not really advocate for either side, but should explain to the court the injury, the extent of the injury, the cost, the diagnosis, and the prognosis. To help the parties get an idea of the costs of a claim, there are internet resources such as Verdict Search and others that can correlate the amount of scarring with average jury settlements in a particular state. If the stakes are high, obtaining previous depositions from experts on either side may be beneficial in establishing credibility. Of course, as always, you're going to look for sanctions on the expert's license. You want to get a sense of how much of his practice is legal versus medical legal versus medical. And most importantly, you want to work with an expert who has a sense of fairness. You do not want an advocate for either side. You want someone that's going to explain the medicine. Next. So obviously, when dealing with scars, we have multiple modalities of treatment. Early treatments include manipulation, whether it be by injections, compression, laser, even radiation. or subsequent excisional so-called scar revisions. And certainly this audience has heard of scar revisions. The goal of a scar revision is to minimize the scar, to make the scar more consistent with the surrounding skin, to create natural tension lines, to minimize the functional deficits. Scars will always remain after healing. Scars are unavoidable. A scar can never be erased. We can perhaps make it better, but we can't erase it. Next. This illustrates, obviously, a scar looking at the center. This patient had an open wound of the face, actually multiple open wounds. And this illustrates the body healing the facial scar with fibrosis. Fibrosis is the body's own mechanism for replacing skin after loss. Fibrosis results from the biological process of wound repair. Fibrosis occurs regardless of the level of the scarring, whether it be the skin, the muscle, bone, or nerve. The body heals by fibrosis. It's natural. Unless the wound is extremely trivial, there's always some element of fibrosis, hence some element of permanency. Paragraph, this scar is going to be less resistant to ultraviolet light. It's going to be dry. It's going to have fewer sweat glands. It may itch and burn. It may break down. It's going to have diminished hair follicles. Normal tissue, such as an uninjured skin, is going to have a basket weave appearance if you look microscopically. If you look microscopically at a scar, the fibrosis, it's going to be linear. My goal in manipulating a scar early on is to change the cross-linking of the collagen. The cells that build that nose back that you see in the middle are the same exact cells that are in the uninjured tissue. My goal is to prod those cells with manipulative technologies to give a smoother, less injured look. I can never erase it, but we certainly can improve it. Even though this is a obvious cosmetic issue, aesthetic, if you will, there are many impacts from this scar. They're going to have an impact on the patient's ability to apply for a job. Two patients, equally qualified, the one without the scar will get the job. It'll have an impact on her facial smile. When she smiles, there's going to be some asymmetry. Facial scarring can be camouflaged, but is always going to be noticeable at a conversational distance. Next. Scars don't have to be from cuts. Scars can be from airbags. Scars can be from burns. Scars can be from other types of injuries besides a gaping type of penetrating impact. A leg can scrape across a pavement, not require any sutures whatsoever. An airbag can deploy with release of chemicals, not requiring any sutures forever. Yet the body will heal with a scar. The scar is going to be visible, obviously. It's going to be permanent, obviously. It's going to have a functional impact. The skin is going to be dry. It'll never be supple. There's going to be a permanent deformity, which is not only cosmetic, but is functional as well. Fortunately, as I will illustrate, we can intervene. Next, please. This is a police officer with a gunshot wound to his forehead, and we were able to intervene. Obviously, a scar revision is of some benefit. However, in this particular patient, by using manipulative technologies, such as the laser, before the scar revision, we're able to achieve a more optimal result. Here, we used multiple modalities to expedite the scarring process, to expedite the healing process. And by expediting the process and manipulating it early, we're able to get a more optimal clinical outcome. The scar will always be permanent. There'll always be the impacts that I described previously, but it's going to be better than it would have been. So in terms of timing, it's typically manipulation first and surgery later. This illustrates the good benefit from a scar revision procedure. Please note, to make the scar look better, we have to make it a bit larger. We have to actually go outside the zone of injury in the revision procedure to get a smooth contour. Next, please. This illustrates a problematic scar. It's called a keloid scar. A keloid scar is the body's response to injury. The body over-responds to injury. The scarring actually goes outside the zone of trauma and actually becomes aggressive. There is distortion of the adjacent joints. There's marked tenderness to superficial and deep palpation. There is some tendency toward instability and breakdown, and these are scars that entail a great more difficulty. These scars need much more than the so-called scar revision. These problematic scars not only are more disabling, these problematic scars have a higher impairment rating. The cost associated with the treatment of keloidal scars is considerably higher than scarring that is not keloidal. So a keloid scar is an abnormal scar. It's an over-response to injury. In this particular scar, and this is often overlooked, this is the response of a body to an orthopedic intervention. Initially, the scarring was quite deep and there was nothing at the skin level. But subsequent to the orthopedic intervention, the patient developed this contractile scar, this problematic scar, and this required multiple disciplinary approaches, specifically manipulation first and surgery subsequently. Next. This again represents a keloidal scar, and it should be emphasized that you don't have to have a cut to the neck or any other body part to get a keloid. A simple scrape, a minor burn, what appear to be a trivial impact could have a very devastating clinical picture. This is a so-called minor burn wound, which resulted in a problematic scar, keloid in this case, to the neck. And by using multiple disciplines, using manipulation first, such as PRP and stem cells, which I'll illustrate shortly, and subsequent surgery, we were able to achieve this result. It is permanent. It is something that's going to always be there, but it did entail considerable medical technologies to achieve this type of clinical outcome. Next. It should be kept in mind that you must think three-dimensionals. A scar very often is more than just skin deep. There is involvement of adjacent structures and organs. There's involvement of adjacent nerves. This has to be diagnosed. There are emotional complex. There are emotional impacts. There's economic impacts, not only for the future medicals, but lost opportunities in life. There's limitations of motion, and it's helpful to illustrate to the court the difficulties this patient has in activities of daily living. When he turns his head right or left to check the street for oncoming traffic, he's going to have limitations and he's going to have pain. But it is important for the expert to diagnose this not only as a scar, but as a full thickness scar, involving not only the skin, but the adjacent nerve underneath the jaw, the adjacent muscle underneath the chin, the adjacent brain, which is the emotional impact, the functional problems related to moving the head and swallowing. So when you diagnose a scar, think in three dimensions. Next, please. So in summary, the scars are a normal consequence of wound healing, regardless of the level, whether it be a heart after a heart attack, whether it be a orthopedic issue after a disrupted joint. or a disrupted bone, or disrupted tendon, disrupted body part, regardless location, heals by scar. My job as a surgeon is to intervene, is to optimize the healing process so we have the minimum amount of scar, and to describe to the jury that scar is a normal consequence of healing, it's unavoidable, there is an impact, and to describe the impact, what can be done, and how much it's going to cost. Scars are often an issue when the attorney evaluates damages, or when the adjuster evaluates damages, or when anybody evaluates damages, whether it be a judge or a jury. So they're often an issue. And I encourage my audience to think in 3 dimensions. Diagnose the condition, diagnose the extent of the condition, it may be more than just skin deep, it frequently is, and describe a treatment plan. The treatment plan early on is manipulative, non-surgical, non-surgical, and subsequently surgical. So let us talk about the plaintiff's view of scars, and then we'll discuss the defense view of scars. The plaintiff could clearly state and honestly state that scars are permanent. The scars are forever. They're unavoidable. Clearly, even scars from an airbag or hot water, hot coffee, even scars that you would normally think of quote-unquote not scars are really scars. The body may heal with impairments that are not visible but are palpable and are certainly present. There's an economic impact. Even without treatment, there's an economic impact. The earning capacity may be compromised because of the employment prospects being diminished. As I clearly stated, 2 people equally qualified, the one without the scar will get the job. There will be economic impact with surgery. Surgery is costly. There's costs associated with the facility, anesthesia, costs associated with possible complications, office visits, surveillance, compressive garments, the list goes on and on. And early treatment, manipulative in nature, such as compression, injections, laser, PRP, and the like, have costs as well. The plaintiff honestly could state that the scarring is visible. Even if the jury may not see it because it's covered by long sleeves, it's visible. A constant reminder of the trauma for the rest of the patient's life. The patient will be given a permanent restriction of avoiding the sun because the sun will tend to darken the scar. The scar may itch and burn because the protective appendages have been compromised. The scarring may get worse with time. It's unpredictable. It may keloid, as I illustrated, or perhaps hypertrophy. In the terms of treating the scar, you could have complications, including, but not limited to, separation of the edges, medical issues, bleeding, deep vein thrombosis, recurrence, keloid. All these costs are possible and are in addition to the projections that your expert would give you. You could advance the argument that if it's a burn scar, many decades later, it could be a source of cutaneous carcinoma. So the plaintiff certainly has losses, both economic and otherwise. The defense, though, has points as well, and certainly the defense could advocate that most scars improve with time. Most scars tend to fade. If you do nothing, a scar will improve. The defense could further argue that the scars could be covered with clothes, hair will grow over the scars, that time will improve the scars, as I mentioned previously. There may be other scars that have healed quite well, and you would anticipate that this scar would heal well regardless of treatment. One could argue that there are genetic factors that have nothing to do with the accident that are causing the scar to hypertrophy or keloid. However, this is a double-edged sword, obviously. One could argue that most operations and/or manipulations occur without complication, and the literature in regard to burn scars is certainly controversial. I think the most important defense argument is that most scars improve with time and they tend to fade with time. In fact, if you do nothing, a scar will improve. So this gives you arguments on both the plaintiff and defense side. You certainly pick an expert who is qualified, who can explain this to the jury in a fair-minded manner. Next, let's talk about the manipulative strategies that I utilized in the case studies I showed you. Certainly my audience is familiar with scar revision, and I'm not going to summarize that here. But the audience may not be familiar with PRP therapy, platelet-enriched plasma. Plasma is naturally found in a person, and we take the patient's own plasma, their own blood, remove it from their body. We'll go to the next slide so I can show this. And I remove the blood, separate out the products in a centrifuge. I spin the products after they're removed from the patient, and this high-speed spinning allows a separation. And I can take out the platelets, which are a rich source of factors that are pro-healing. By healing early on, we have less scarring. So if you look at a joint or a heart or any body part, including the skin, if it's injured, it's going to heal with the scar. And we can manipulate this process by injecting the body's own tissue into those zones of trauma to get the body to restore a more natural result. Next, please. Stem cells can also be used. They differ from platelet-enriched plasma because they are immature cells that have not yet become anything specific. They are have many different potentials. And one potential that you can do from a stem cell is use it to rejuvenate toward healthy scarring. A healthy scar has less inflammation. It's being manipulated to heal in a more natural fashion, and by doing so, you have optimally a better result in the long term. Stem cells are harvested either from the body's own fat or from the bone marrow. Because there's much more body fat available and it's less invasive, we are getting stem cells from fat. We take the fat from the patient, liposuction if you will, treat the aspirate in such a way to obtain these stem cells and use these stem cells directly into the zones of trauma and scarring. Those little blue stem cells are little fountains of youth. They are also restorative, they're regenerative, and every day the list of indications for stem cells and platelets grows. Next. Stem cells and platelets can not only be used for scarring, it could be used for pain, because as it turns out, pain is closely associated with inflammation. Scarring is closely associated with inflammation. And if you can control the scarring, you can presumably get less inflammation and get less scarring in the long run. In injuries where you have loss of hair because of the fact that a brick has fallen on the head, for example, and you've injured the hair follicles, you can restore the hair follicles with stem cells and platelets. If you have a bicep separation and you have a loss of contour, I'll illustrate this in the face, you can use fat grafting and PRP to restore a deformity in 3 dimensions. In a functional issue like a contracture where a tendon is bent, PRP and stem cells can be used to restore motion by controlling inflammation. Next slide. Certainly, it should be emphasized that early, proper treatment in the long run results in less costs to the medical system as a whole. Early treatment of a scar with manipulative strategies can minimize the necessity for scar revisions down the road. Early, accurate, prompt treatment can lead to a more optimal outcome, not only clinically, but economically. So there's a wide range of injuries, and in explaining to a carrier the costs up front, it's helpful to emphasize how worthwhile it is to manipulate early, subsequently operate, as opposed to wait and see. It's a evolving concept in plastic surgery, but certainly early on reconstructions tend to have better results than secondary and tertiary procedures down the road. Paragraph, when looking at the value of a claim, there are guidelines such as ICD and CPT and relative value schedules, which can give an estimate as to the patient's future medical costs. One no longer has to guess. These relative value fee schedules are published and are widely available to both the plaintiff and defense bar. The days of guessing on future costs certainly do a disservice to both the court as well as the patient because of the fact that the guidelines are readily available. It should be mentioned that the value of the majority of scar claims are readily available on the internet by looking at such websites as Verdict Search and the like, where one can look at the percentage of the body burned, the age of the patient, and plug these variables in and get a sense of how juries have come back with various awards and or how published settlements may have resolved the claim. Next. This illustrates the value of PRP in rejuvenating an injury. This patient has loss of tissue from acne, very similar to the situation from an airbag where you have atrophy of the skin. It's again, think three-dimensionals. It's more than what you see. It's what you feel. It's what is deeper than what you see. And by thinking three-dimensionally, one could restore the zone of trauma by using manipulative technologies first and surgical strategies next. Next slide, please. The principalization of my field. Scars of the skin are treated very similarly to orthopedic sequelae, because in truth, orthopedic sequelae are very often the body's response to injury, which is, as I said, scarring. And by controlling the body's response to injury, by manipulating early, presumably you can get a more optimal clinical result. So it's a principalization of plastic surgery, using the body to heal the body. Since the body is going to heal itself with scar, regardless of location, let us as medical professionals offer the patient the ways that we can assist the body in assisting itself. Next. So thank you for attending today's webinar, and we'll take some questions. I guess that's it.
All right, Dr. Zaidan, thank you so much for your time today. It was an excellent presentation. If anybody is interested in retaining Dr. Zaidan as an expert witness, please contact the Expert Institute and we will facilitate the engagement process. Thanks again, and stay tuned for more webinars in the near future.